for Lancashire Care in the pain service, and we've got local GP, Dr. Dasu, and Dr. Ibrahim Patel as well here, who will deliver the rest of the presentation. And we had some sisters as well, Sister Rehana, and who's a diabetes specialist, and Dr. Desai, who delivered the talk in the morning for the women. So just a bit of background about British Islamic Medical Association. So it's a volunteer-led organisation, and it's delivered by healthcare professionals, and we're present in all parts of the UK, even Scotland, Wales and London, and the organisation is split into sub-teams, and we have different volunteers in different areas. And it's built on its strong Islamic values and to try and bring the skills of the Muslim healthcare professionals and take it out into the community. And as it says at the bottom there, there's over 2,000 members, which consists of doctors, pharmacists, dietitians, dentists, optometrists, nurses, paramedics, nurses, students, so on and so forth. And this whole presentation is the same presentation that's being delivered across the whole country. And the presentation content was designed by diabetes specialists and nurses, doctors, and everybody had an input into this presentation. So that's just a mission statement, to inspire our members to unite in the service of our patients and profession. And just a quick disclaimer before we start the presentation, that the information that's provided here today, obviously we can't cater for everybody's individual medical needs. So again, we would like to say that if you have any specific conditions that you want to discuss with your healthcare professional, then please make an appointment with your GP or go to your local pharmacy, etc., to access specific advice. BEMA has no conflict of interest with this presentation. They didn't receive any funding or anything from any pharmaceutical organisations. And we've obviously tried to make sure that the content of this talk is accurate at the point of delivery. As I say, it was organised by healthcare professionals working in that field. But if you do find any information that's inaccurate or incorrect, then please let one of the speakers know after the talk, and then we can take that feedback forward, inshallah. Yeah, so I'll just hand you over to Dr. Ibrahim Patel, who will take you through the next few slides.
Jazakallah Muhammad. So I'm a GP registrar in Fleetwood, which means I'm training to be a GP. Nearly finished, so inshallah, make dua, inshallah, be successful. So this talk is mainly aimed at looking at the health issues around fasting. So the benefits, the risks, and also looking at sort of general sort of weight loss, exercise, healthy diet. And we'll look specifically at diabetes as well, inshallah. So before we start, this simple question, why do we fast? What's the reason that we fast? So it's a command of Allah subhanahu wa ta'ala. Well, obviously one of the pillars of Islam, 5 pillars of Islam: Iman, Zakat, Zakat, Hajj, Salah, and fasting. So one of the pillars of Islam. So it's very important to all Muslims that we fulfill this duty upon us, that we fast in the month of Ramadan, and we have the desire to fulfill this duty as well. So when we see people amongst us that they are fasting, and unfortunately we have a medical condition which means that we cannot fast, we feel that loss, in ourselves, that we are able to partake in this kind of, this activity. But we'll come on to this inshallah in the next few slides. So there's also health benefits to fasting as well, and we've got the the voluntary fasts, obviously fasting in Shawwal, in Zulhijjah, the Monday and Thursday Sunnah fasts, and sort of other fasts that we can keep. Okay, so the health benefits of fasting. Obviously there's plenty of health benefits in fasting. Unfortunately, there's not been any rigorous studies done for fasting in the month of Ramadan, but there's been some anecdotal studies and sort of basic, simple studies as well. And we can understand that, yes, if we eat less, we're going to have some weight loss. If we eat less fatty foods, and if we're eating less, then we're eating less fatty foods as well, so we're going to improve cholesterol and improve our blood pressure as well. For diabetics, obviously, our blood glucose control will improve. Yeah, and one of the important things that we have to highlight is that obviously we're spending 16, 18 hours fasting, which means that we're staying away from certain habits such as smoking or snacking on unhealthy foods. So that gives an indication that we are capable of, reducing the amount we smoke, or reducing the amount we eat unhealthily, and or even stopping smoking, which is very important sort of health advice, and we'll come on to that in the next slide. So these circles represent the amount of impact smoking, obesity, alcohol has on sort of preventable deaths. I'm not sure what these numbers exactly mean, because I'm not sure what the total amount is, but the size of the circle represents the amount of impact. So we can see how big an impact smoking has compared to other things. And if we just think about it, smoking, obviously we inhaling the toxins into our lungs and the tar, it has an impact on our whole body. So every single organ will be impacted by smoking, from heart disease to stroke to cancers. Everything is affected by smoking. And we talk about kind of COPD, where our lungs lose the capacity of working, and the person's out of breath on a constant basis. So imagine you're sitting at home and you want to go to the toilet, but you know that you'll be out of breath by the time you get there because of this COPD. Or you want to go to the masjid, but you struggle by the time you get there, you're very out of breath. So this is the impact smoking can have. So we have to really think, yes, we're using smoking maybe as a means of relieving stress or as a means of tackling constipation, but that we can relieve our stress by, walking or doing other things, praying salah, doing zikr. And, there's other treatments for constipation. So the negative impact of smoking outweighs the benefits, definitely. So I would recommend everyone access some support. The NHS has smoking stopping service. We can give you the number at the end, but you can get it off the website as well. And I recommend everyone that if you know someone that is smoking, advise them to try and reduce the amount they smoke, and or try and stop smoking as well. And Ramzan is a good month to practice that. Some people when I say that to people, some people say to me that, but when I stop smoking, I start coughing, start feeling worse. But smoking is an addiction. So when you stop an addiction, your body will go through some withdrawal symptoms. So you expect to feel worse initially, but gradually you feel better. So inshallah, that's my sort of lecture finish. So health risks of fasting. So we don't really think about this. There's some medical conditions, some situations where fasting can cause an issue. And when you think about it, these can be sometimes quite serious. So one of the main things obviously we think about is dehydration. Yes, obviously we're having less water in the hot summer days as well, a long fast. There's a risk that we can get dehydrated. Stress, obviously less sleep, we're eating less, we'll be hungry, we're praying tarawih in the night, waking up for tahajjud. So these kind of activities obviously will make us more stressed as well, potentially. And obviously some medical conditions can be worsened if we fast as well. So we'll get onto that, inshallah. So there's a brief list. Obviously, it's not a complete list, but there's something we need to think about. So we'll talk about diabetes in a second. But obviously, if we're on medication for diabetes, or if we're on insulin and we do not eat, then obviously there's a risk that our sugar levels will increase or become or decrease as well. With asthma and COPD, people are taking inhalers and medications like that. So if they're fasting, they're unable to take their inhalers or have to change the dose or the type of medication, that can potentially worsen their condition. Stuff like heart failure, chronic kidney disease, these kind of conditions where someone is having to control what they drink and what they eat and the medications they're taking. So obviously if you're fasting, that can have an impact on that and worsen that condition. Some mental health conditions. Generally, if you've got stable mental health condition, we can generally say that you'd be okay to fast, but obviously I advise everyone to speak to their own individual GP and in that situation, or psychiatrist. But some medical conditions like schizophrenia and bipolar disorder, I would advise speak to your GP and psychiatrist just to check whether you're able to kind of fast with the medication regime that you're on. Glaucoma. So glaucoma is a condition that you get when you get increased pressure in your eyes. So people take regular eye drops. So stopping eye drops can potentially cause worsening of the eye condition as Infections, yes, obviously people get chest infections, skin infections, other types of infections. If you need antibiotics, there's some courses of antibiotics you can take once a day or twice a day, so that potentially could fit with fasting. Other courses of antibiotics you need to take 3 or 4 times a day. So I would advise you to really consider whether you can go without taking antibiotics, because if it's an infection, potentially could get worse. So we need to think about that. And obviously, pregnancy, breastfeeding, there's general recommendations. This is just a brief slide talking about the impact of fasting on the body. So once you've had your last meal, it takes about 8 hours before your body starts to break down the stored sugars in your muscles, in your liver. And then it takes a little bit longer to break down the fat. So obviously, if you're diabetic, then the longer you stay without food, then there's a risk that you become low in sugar as well. Your sugar levels become low. And if you're taking certain medications especially as well. Okay, so this is important. So some medical conditions, we are exempt from fasting, which means we have permission not to fast in medical situations. So obviously the Quran specifically tells us that if you're ill, then you can you have permission not to fast. And in that situation, obviously, if you ask the ulama, we can give compensation, fidya. So the compensation can be fasting at a later date. For example, if you've got an infection, then you take antibiotics for that period of time, and then you can make up them fast at a later date. Or if you're in a situation where potentially you can't fast going forward, then you can give compensation, some sadaqah, in compensation for the fasts. So these are just a representation of what things are going through a person's mind, or what sort of things are pulling a person. So you've got your own individual self, you've got your, sort of obviously in Islam, obviously we recommend it to fast, and obviously our medical conditions as well. So we have to balance all these things, and the purpose of this, having this discussion, this talk, is that we all kind of have a think about, before Ramadan starts, what kind of issues may I have, in terms of my medical conditions, and if there is any issues, then we should approach our GP or a health professional, and also approach the ulama as well. So if we move on to diabetes, Dr. Russell will just give us a brief.
Assalamu alaikum. The purpose of this talk is not to change anything, or not to stop people from eating. The purpose of this talk is to educate. So we can either talk in English or apna Gujarati mat kariye. What do people prefer? Just a show of hands, English or Gujarati? English? English? Okay, that's fine. Okay. So I've had some visitors come to my house this morning from London because and he's diabetic. So I had to leave, and he goes, "Where are you going? You need to sit with me." I said, "No, I need to go and do a diabetic talk." And he goes, "Diabetes? Allah Pak kehta diabetes ne jannat ne ticket aipit aata Ramzani ticket aipit." So basically saying that if you're diabetic, you shouldn't fast because Allah has given you a ticket. You don't need to fast. And the thing is also is that people think, "Oh my God, doctor's here, he's going to tell me, oh, don't eat this, don't do that, don't eat pakoras or bhajias or whatever." That's not the purpose of this talk. The purpose of this talk is to educate, and you guys can make the decision on what you think is right and wrong. Just to give you a flavor of what is expected in people who suffer with diabetes, or patients, or people of carers, or care for people who have diabetes, and how to tackle certain pitfalls, complications, what to be aware of, what not to be aware of, just give you an idea about that. So the thing is, before we get to this stage, we have to understand a bit about diabetes. So what is diabetes? So diabetes is an illness of high sugar in your body. Okay? So patients who are diabetic have a reduced capacity or lose the capacity of digesting the sugar in the body for various physiological processes, which we're not going to discuss today. Okay? That's too complicated. So when we eat, okay, our food is digested, and certain foods are broken down in different ways, and the sugar is also broken down in different ways. And when the body's capacity to break down the sugar, therefore leads to higher sugar levels, which can lead to diabetes. That's what diabetes is. And Allah subhanahu wa ta'ala has made us our bodies, okay, so we have to enjoy the bodies. And Allah subhanahu wa ta'ala says you have to eat. You know, even food is ni'mah of Allah subhanahu wa ta'ala, so why should we stop eating? But Allah subhanahu wa ta'ala also says that you have to eat the tayyib foods, the foods that are halal, not only halal, the foods that are good for you. So you just shouldn't eat the food for the sake of eating, but you should eat the right food, like the Prophet ﷺ did, that is beneficial to your body as well. So that is very important in diabetes also. But the thing is, there are certain risks for patients who have diabetes in Ramadan. So the first risk is hypoglycemia. So hypoglycemia is a condition where the sugar levels in the body reduce too much. It can be quite serious. So basically, our body has to maintain a certain level of sugar for us to survive. For example, certain level of oil and petrol in the car. So if the sugar levels drop too much, it's serious. If the sugar level is too high, it is also serious. So the symptoms of hypoglycemia, I always tell my staff when I come to work in Ramadan, so don't burden me too much, because I'll be very angry and very hungry. And if I'm angry and hungry, you don't want to come near me. So basically, you get anxiety, laziness, you can become a bit raged. So basically, on the right-hand side, there's a list of things that you can feel of. It's not very clear there, but sometimes you can feel a bit dizzy, you can feel a bit ratty, a bit anxious, you feel tired, you feel a bit confused sometimes as well. These are all symptoms of the hypoglycemia, which means that the sugar levels in the body are not adequate to support itself. The second thing is hyperglycemia, which means that there's too much sugar level in your body. Also, is not good. So the symptom of too much sugar is stomach pains, irritability, very thirsty. Again, the symptoms kind of overlap with each other. And the third most important thing is dehydration, which is on the left of the slide. In the summer months, Ramzan, the main risk is actually dehydration, as opposed to hyper or hypoglycemia. Now, there is one way of knowing whether dehydration, whether the person has dehydration or not. And the grid here shows the color of the urine. The normal urine color is yellow, straw colored, dark yellow, light yellow. And everybody knows what the color of urine is. It can vary depending on what you've eaten, what you've drank, your medication. Lots of different aspects can affect the color of the urine. Therefore, individual color of urine can be different. But in dehydration, the main thing is that the urine color becomes very, very dark, quite brown, sometimes orangey, very dark. And that is a good sign of dehydration. Apart from that, dry mouth, lips, skin, less urine, and excessive thirst is also a sign of dehydration. So basically, this is a side of action plan. So if you have diabetes, then I think the brother mentioned it before, you need to visit the doctor, the diabetes nurse, a pharmacist to find out about diabetes. You need to speak to a healthcare professional or a scholar to see whether you are able to fast or not. And sometimes you can use Sha'ban as a way of testing yourself. So have some fast in Sha'ban, see how you are, try different things in Sehri, in Iftar, find out what works for you, find out what doesn't work for you. That is one way of doing it. It's not sunnah, I think it's just an active way of finding out. Someone mentioned, I saw the Messenger Sallallahu Alaihi Wasallam fast an entire month of Ramadan, but I never saw him fast more than he did in Sha'ban. So it is sunnah to fast in Sha'ban and Ramadan also. So basically, this is the main thing. How should I manage my diabetes? So many patients who have diabetes will have different medication regimes. So some will be once a day, some twice a day, some even 3 times a day. What is important to understand is that not all medications reduce sugar levels. Not all cause hypoglycemia, but some medications can reduce sugar levels. So you need to find out what they are. You need to ask the pharmacist or the doctor, the out of my list, is there any one that I should be aware of? And it is better to either avoid those medications or take them with food. So either take them with iftari or take them with sehri. But majority of the old medications are usually safe in Ramadan, in fasting as well. And they don't generally cause hypoglycemia, which is a drop in the sugar levels. What I suggest to my patients is that change all your medication to either once a day or twice a day, because obviously you can only take it twice a day anyway, because in the summer months you only have 5 or 6 hours where we're eating. So it's irresponsible and not very convenient to take medications 3 times in a gap of 6 hours. So it might mean that you might have to omit some medications, and you might have to reduce some tablets, or reduce the doses of some tablets, or reduce the amount of medication you take in Ramadan. And follow an individualized medication plan, so that depends on what your tablets are. And follow exercise regimes. So I think, what is here? People ask me that, do I exercise in Ramadan? It is safe to exercise, and it is safe also to be active. So do what you normally do in your normal regime. So you walk to madrasa, you walk back home, you go for your normal walk. And I think there is a slide about exercise in the later part of the presentation as well. But avoid any rigorous exercises, but be active. If you have a blood glucose monitor, it is also important to check your blood sugar levels in Ramadan as well. The best time to check is about an hour before iftari to find out what it is. Sometimes it's better to check hour after iftari as well. And the most important time to check is about 8 hours after the sehri, because that's when your sugar levels are likely to drop. Because like the brother said, that after eating, it takes about 8 hours for the body to digest everything fully. And our body only enters in a state of fasting, physical fasting, after 8 hours. So if approximately the sehri time is about between 1, 2, and 3 o'clock, around, depending on the time of the year as well, and the month. So when you wake up in the morning, that's the best time to check the sugar levels. When to end the fast? So if the sugar levels are less than 4 or 3.9, it is medically recommended that you should break your fast. Because if your sugar levels are too low, and if you have hypoglycemia, then there is a risk, there's the risk of some complications that can be quite serious. And if your blood sugar level is higher than 6.7, it is also better to break it. But I'm going to put in a disclaimer here. So if you're diabetic, and if you don't follow a diet plan, then after iftari, an hour after, it might be 16 as well. So I don't expect you to break your fast straight away, okay? So what I mean by this is that if you have checked your sugar levels during the day, and if it is 16, then you have got risk of hyperglycemia. And there are also other complications of that. There are some medical conditions called diabetic ketoacidosis, non-ketotic hyperglycemia, and it can lead to serious complications, kidney problems, coma, and other complications. It is better to break the fast if your sugar levels are too high. If your sugar levels are always this high, then it is probably not safe for you to fast. And it is better to end your fast and break it if you become dehydrated. Patients who are on insulin should speak to their nurse or the doctor, the pharmacist, but it is better not to stop insulin, because there are 2 types of diabetes, one that needs insulin, one that does not require insulin. But if you have a type of diabetes that require insulin or the injection regimes, then if you stop it, the sugar levels will invariably rise. So therefore, it is important to continue those. But you might have to monitor or change the dose of the amount of insulin you take. So you will have to continue, but you might have to change the amount you take to control your blood sugar levels. So guidance on medication. So the diabetes can be classified into 3 different parts. So one that is well controlled, one that is moderately well controlled, and one that is not well controlled, or one that is mild diabetes, one that is medium diabetes, and one that is very high diabetes. Okay? So when patients have diabetes but generally well controlled, they're very well with the medication, and the blood sugar levels are fine, you don't actually need to make any adjustments apart from maybe changing the timing of your tablets. And it is perfectly safe to fast as well and to go on with your daily routine. Patients who have moderate risk, like middle diabetes, patients who have type 2 diabetes or on insulin, it's better to have a management plan of your diabetes. So what to take, how much insulin to take, what changes, whether the dose needs to go up or down, do I need to change the timing of my insulin or the medication. And patients who have high risk diabetes, so or patients who have either poorly controlled diabetes or patients of CKD, which is chronic kidney disease, or diabetes affecting other organs as well. For example, the eyes, the kidneys, the nervous system. Then they've got the high diabetes. It's recommended generally not to fast, but then obviously it is better to check with the ulama as well. Patients who have type 1 diabetes, again, it is safe to fast, but in summer months, the diabetes, the fast are very, very long. And patients who have type 1 diabetes generally have different types of insulin. There's an insulin that works very long hours. There's a short-acting insulin that only works for a short time. So it is better for them not to fast because they need insulin for, on a regular basis. And in patients who belong to those categories, it is better for them to avoid fasting on medical grounds. So there's another slide is about here, eye drops. It is safe to use eye drops in Ramadan and also when you're fasting as well. This has been, I don't think there's a fatwa on it, but there's a general belief among ulamas that using eye drops does not generally break the fast, because not a lot of the eye drops actually enters the gastric system anyway. But if you're doubtful, then obviously you need to speak to the ulamas. And just before I finish very quickly, what the brother mentioned about smoking, there was a slide there. That slide, the biggest bubble was that smoking is the single biggest killer, and it corresponds to lots of other infections and also chronic diseases as well. In Ramadan is the ideal opportunity to stop smoking. We've got Brother Talha, who's in the outside near the van as well. He works for the Quit Squad, which is a stop smoking clinic, and they can tell you different ways of how you can achieve stop smoking or achieve the goal of stopping the smoking. The take-home message is talk to your diabetes team before you start fasting. But generally, if you belong to the first two categories, it will be the safe. Test your blood sugar regularly before iftari, an hour after iftari, and about 8 hours after the fast has started. Look for signs of hyperglycemia and dehydration. Make sure that you know. So basically, you need to tell people, generally speaking, the community we know, but if you're diabetic and if you're at work, make sure you tell your work colleagues, or if you go out on a long journey, you tell your sati, your travelers with traveling with, that you are fasting, then they know about it and they know what to do if there's a complication. And always carry a sugary drink or a glucose pouch or a tablet or a sweet with you in case your sugar levels drop and you have to break your fast. And if you're ill, then break your fast. And if you're ill, and if you can't fast, it is better not to fast rather than take any risks. Jazakallah. Any questions at all?
Okay, so Jazakallah, Dr. So for going through diabetes for us. So last few slides are just on about a few other things like nutrition, exercise, and things like that. So some basic recommendations. Obviously, we should try and keep a healthy diet. We'll go through that in a second, the next few slides. Avoiding sort of too many fatty foods, too many sugary foods. Exercise, like Dr. Rasul said, we should continue our normal activities, as long as there's nothing too sort of rigorous, where we're going to tire ourselves out or become dehydrated. Obviously, our Tarawih prayers and stuff like that is counted as well as in activities. We should have, if you're diabetic or if you've got other medical conditions, obviously we should have a plan for ourselves how to manage the Ramadan fasting. And like we've heard before, we should break our fast if we sort of become ill, especially with diabetes. So this thing here, this poster is just the NHS poster on exercise and what kind of exercise we should be doing. So we see two numbers here. This is not specifically about Ramadan, this is just generally. So 75 and 150. So 75 minutes per week of vigorous activity. So what does that mean? obviously they've got lots of sporting activities, but that basically means that you're so active that you struggle to speak because you're breathing, because you're breathing. And moderate activities where you're kind of out of breath a little bit, but you're still able to speak. So there's examples there, so fast walking, normal pace walking, cycling, swimming, other examples. So that's just kind of an example of how much activity we should have on a weekly basis. So obviously in Ramadan, we should continue to be active, but we should sort of be careful not to be sort of too active, so we become dehydrated or have low sugar levels. But this post is a good indication of what activities we should be doing. I mean, obviously, as we get older and we're busy working and stuff like that with children, we become less active. But if we can sort of fit activity within our week on a sort of weekly basis, then that's good. I mean, for example, if I'm working behind a desk in an office, we press a button, the patient comes in, and we just sit there, for 9 hours, whatever it is, sort of seeing patients. But what I can do is potentially go to the waiting area, call a patient in. So I'm adding extra activity throughout my day. So something simple like that whilst we're working, that can sort of improve our activity levels. So this again is another NHS poster, and it's meant to represent a plate. And these are different food groups. So you've got the fruit and vegetables, you've got the sort of starchy stuff, you've got the dairy products, and you've got the protein, the meat, fish, and eggs. So that's kind of the size of the proportions. That's how much we should have of each. So obviously you can see that there's a large portion should be fruit and vegetables. Another large portion should be kind of the potatoes, bread, pasta, rice, those kind of starchy foods. And the recommendation is to have sort of wholemeal, sort of brown, sort of rice, brown bread, because it's higher in fiber and has more vitamins. In terms of the dairy products, you can see milk and butter. We should try and have more kind of sort of the oils and butter. Sorry, we should have more sunflower oil, olive oil, butter, which is sort of less in saturated fats, and that can help just generally to lower our cholesterol with heart disease and stuff like that. Obviously, this is kind of the recommendation, and my diet is miles away from this. Not anything like this. We have too many sort of crisps and chocolates and cakes and stuff like that. But Ramzan is a good opportunity to change, a few things. We don't have to change everything. So, for example, we have a lot of fried food potentially, depending on your ethnicity. So we could either have less fried food, or you can cook in a different way, grill stuff. There's stuff like air fryers, which has very minimal amount of oil in. So we just have to change a few things. No one's telling everyone to, that you should eat this, this, and this. But if we just look at our own diet and try and sort of change a few things, so we're a bit more healthier going forward. And obviously at the corner there, it says 6 to 8 glasses of water per day. So in Ramadan, obviously we'll have 2 meals. We'll have the suhoor and iftar. So suhoor with the sahri, they advise us to have a mixed sort of meal, so not just one type of food, like we saw on the plate. So a mixed diet. Have a moderate amount. Don't kind of sort of stuff ourselves so that we very sort of full. And we should. There's something called low glycemic index foods, which basically means foods that burn slower, so the energy lasts longer throughout the day. So which is basically the stuff like porridge. I think there might be a slide later on, but sort of lentils, wholemeal foods, and some vegetables. They burn the energy slowly, so it's better whilst we're fasting. And obviously we take plenty of fluids as well. Obviously the timing of suhoor makes a difference to our fasting, so it's sunnah to take it a bit later on towards the end part. Okay. So this is something one of the nutritionists has come up with to try and get more fluid get us to drink more fluid whilst we're fasting. So not just to drink lots of water at sahri time, before the fast starts, because obviously then the body will just get rid of the excess fluid. It's better to try and spread it out amongst the hours that we've got, and we've got a short time. So they say kind of when you break your fast, have a little bit. When you before you start eating your iftar, after your iftar, throughout the Tarawih period overnight, you have about sort of a bottle of water, 500 mils. And then before you start your suhoor and then after your suhoor. So you're kind of spreading out the water, so you're not just having it all at once. So that might be a way of us trying to sort of hydrate ourselves a bit more. again, a lot of people will be used to having tea and coffee and stuff like that. Obviously, drinks like that and fizzy drinks can make us more dehydrated because the chemicals in there make us produce more wee as well, more urine. So it's important that we kind of drink sort of clear fluids if we can. I mean, not saying don't have a tea or coffee, but try and reduce the amount. So again, yeah, so the high fiber sort of foods which are better, like I said, the wholemeal bread. I think that's a potato in the center. I'm not sure, sweet potato, I'm not sure what that is. Some rice, porridge, and vegetables. maybe. So again, iftar, obviously we all know kind of khajur and water. Again, like suhoor, make it balanced, and again try and sort of drink so plenty of fluids as well. Yeah, so like we said, healthy options. So the deep fried sort of samosas and bhajiyas and all that type of stuff. I'm not saying don't have them, but there's maybe a different way of cooking them or have less of them. More fruit and vegetables as snacks rather than sort of chocolates and crisps and stuff. And yeah, so caffeinated drinks, so tea and coffee, try and reduce the amount as well. But sometimes people do take it because it helps them with headaches and stuff like that. So not to say don't have it at all, but reduce the amount. This is, I think someone's come up with some healthy or ideas for different sort of cultures, I think. So again, grilled chicken, a lot of people from South Asian sort of background. Instead of having a lot of meat all the time, sort of mix it up with some vegetables, sort of vegetable curry and dal as well. Like I said, air fried stuff, which is kind of less oil content. And when you're eating roti or rice, the wholemeal sort of version is better. I'm not sure what some of the dishes are on the other sort of Middle Eastern. I'm sure some people will recognize them. But yeah, so they're all healthy options. Yeah, so oral hygiene. Obviously, everybody knows brush your teeth. Obviously, but so it's a sunnah. Obviously, the miswak, and obviously a lot throughout the year, 11 months, we're not using the miswak too often. You're not carrying it around with us. This could be a means of us kind of reviving the sunnah of Prophet ﷺ. And just carry the miswak around. There's different ways of carrying it, different sort of things, and that's a good way of keeping oral hygiene. It does mention about using a mouthwash in and out of fasting. I'm not sure whether there's a difference of opinion, but anyway. We can obviously brush our teeth more, when we sahri and iftar, and then obviously also use miswak as well. Yeah, so things to kind of take home. Obviously, fasting is a hukum of Allah subhanahu wa ta'ala, and is a pillar of Islam. So we all have that desire to fulfill this, but we just have to have a plan if we have some medical conditions in order that we sort of stay healthy and do not kind of worsen any of our medical conditions or have any complications. So the best way to do that is to speak to your health professionals, speak to ulama and get sort of their opinion. Obviously there's benefits with fasting. We know about weight loss, cholesterol, blood pressure and things like that. In terms of activity levels, try and stay active as normal, but nothing too excessive. There's a translation of one of the Quran ayats from Surah number 7, verse 31, which Allah subhanahu wa ta'ala tells us to eat and drink, but not excessively. So again, mentioned at the end, sort of have a plan, sort of diet plan for Ramadan. There's some leaflets outside with this from Diabetes UK, which is Diabetes in Ramadan, some helpful tips and some more advice if you want to take from outside. And these are the people who've sort of done the presentation or prepared from the talk. So there's some consultant from the hospital in Birmingham, so endocrinologists or specialists in diabetes and things like that. There's some sort of nutritionists and dietitians as well who've worked to, for this talk as well. And Jazakallah, may everyone have a productive and healthy Ramadan. Is there any questions? Inshallah, Mawlana is here as well if there's any sort of fiqh questions or any masalas we need to ask. So inshallah, you can ask your questions. Anything particular about sort of if they've got hyperglycemia, it depends how high it is and how long it's been that high for. But it's very individual, so we'd advise you to seek some medical help. But, yeah.
Other medication you have to bring the sugar levels down. So you don't want to bring it down very quickly, but the complications of diabetes when the sugar levels are very high are higher after that.
We've got one.
Yeah. No,
3 point something and 16 point
no, no,
doctor amune deta hai nathi
no,
advice diya ki don't pick it
no. Generally speaking, diabetes is a picnic kanu. Just stand up. Generally speaking, you know, diabetes hoy ni te amuk dawai te sugar levels drop not high. Te indicate check karu na pare. आटा खाली रमजान रखे केम के आप डायबिटीज ની દવા લઈએ ને આપણે ફાસ્ટિંગ કરીએ તો શુગર લેવલ્સ ડ્રોપ થઈ શકે એટલે ખાલી આ મહિના દેખે જ રેગ્યુલર દેખે નહીં રમજાન ના એટલે તમને ડૉક્ટર મશીન ટાઈમે ફ્રી મળે મશીન જો હોય ને ડાયાબિટીસના ના વેચાણ નહીં એમ બી ફ્રી મળે ડૉક્ટરની સર્જરી પર છે ને જે ડ્રગ કંપની હોય ને તે મશીન તો ફ્રી જ આપે એકચ્યુઅલી તમને ખાલી પ્રિસ્ક્રિપ્શન પેલું સ્ટ્રીપનું લખાવવાનું હોય ને સ્ટ્રીપની મશીનની હાથે મોસ્ટલી આવે તમારે એટલે અબાઉટ થોડા ટાઈમ તક યુઝ થાય એટલે તો મશીન રાખે તો એમ બી તમને બાય ન કરવું પડે કેમ કે ડૉક્ટર પાસે કે ફાર્મસીસ્ટ પાસે જશો ને તમે તો મશીન એમ જ આપી દે તમને પણ જેનરલી સ્પીકિંગ આફ્ટર રમઝાન ચેકઅપ જરૂરી નથી ત્યારે ખાલી રમઝાનની અંદર જ રોઝા લાંબા છે એટલે તમે ચેક કરો સારું હા હા એટલે એકચ્યુઅલી ઇમિડિયેટલી થોડું સેફ છે હવે તમારો શુગર લેવલ બહુ લો થઈ જાય ને ત્યારે સેફટી એ જ છે કે તમે તરત તોડી કાઢો તમને વાત નહીં જોવાની કેમ કે વાત જોવાની બહુ હજુ લો થઈ જાય વધારે તો પછી અમુક સ્ટ્રેટ અવે જનરલી જી ના 1 hour વાત નહીં જોવાની ના you should break it then child Toriko, better, that's better. But Mulsa, what do you think? Is that? Yeah. 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 Nah. Yeah.
I think एक वस्तु रिमेम्बर करनी कि तुम्हारा रोज़ो 1 કલાક પહેલા તોડો કે શહેરીની પછી તર તોડો તમારો રોઝો તો તૂટી જવાનો જ છે સમજ પડી so no matter how close you are to iftari time you won't there's no such thing your roza will be broken anyway so if you're going to break it 1 hour before because your sugar levels drop then you need to think that well if I broke it 1 hour after sahri there's no difference that oh you obviously the reward that you'll have gained because you'll have fasted for longer but people think that oh there's only 1 hour left but in that 1 hour what Dr. Dasu is trying to say is that you can do that much damage to your body and it's not just if your blood sugar level drops you might faint but especially for people with diabetes going hyper and hypo can cause long-term complications and I think that irreversible damage is what we're trying to prevent.
But also, I think you have to understand as Muslims, Allah subhanahu wa ta'ala does not actually look at the action. Allah subhanahu wa ta'ala looks at the intention. I think I have heard hadith before. I have also listened to certain bayans where the speaker has said, Moli Sahib, that somebody who starts to memorize the Quran and they've only done one juz and then they die, I think it is true that you have to assume that Allah subhanahu wa ta'ala, because his intention was to learn the whole Quran, they should get the sawab of the whole Quran, something like that. So I think if the intention was there, you probably will get the sawab inshallah, but I think for your body's safety, it is better to break it straight away. I know that's not the answer you were expecting, but...
Is there any other things who can hold the barometer?
Nah, તમે જાગતો હોય કે no, the thing is તમે શું છે એટલે તમે હુઈ જાઓ કે તમે જાગો તમે ચાલો કે ઊભો રહો એનાથી કશું ફાયદો ન થાય Yeah, exactly. The tama huijar obviously is better. Agar tamane rakwa zorzo it's up to you. Tama huijar sort the time will go quicker. But auna take a sugar level but that drop nahi thai.
No, no.
Yeah.
If you go to sleep, right?
Ji.
When blood level, sugar level down,
Hmm.
it's always you sleepy. You go to sleep.
Hmm.
What happened in 1 hour?
But what if you go to sleep? Possibly. What if you go to sleep? Tama koma watch it or bache it risk it could happen. That's the thing.
Another question.
Ji.
There is a diabetic who has for a number of years,
Ji.
and the diabetic one has a plague in old age like myself and other people,
Ji.
3 years, 4 years.
Yeah.
And any difference between those two?
There is a difference. Main difference which है कि the age also depends on your sugar levels. क्योंकि the body's requirement for the energy, body's requirement for food, body's requirement for different aspects is different according to how old you are as well. Okay, so the amount you eat and drink, the amount you sleep is always different. So yes, there is a difference, but that difference is individual. So if somebody who's 80 years old and somebody who is 50 years old, they both have diabetes, assuming that they both have same type of diabetes, same level of diabetes, the one who is 80 has to be more careful. But there could be young diabetic who are on insulin. It's not to say the young patients don't get bad diabetes.
No, no. One had diabetes for 20 years,
Yeah,
and one had 4 years.
yeah.
So they did more.
No, no. It's act, the duration you have diabetes doesn't affect it, but your age will affect it. Yeah. Yes. Yeah. The thing is, in generally, there's a term called calorie deficit. Okay, have you heard of that? Calorie deficit? So, calorie deficit, say, for example, in a man, in a general day, you need 1,800 calories approximately. Sorry, 2,000 calories. And a woman is 1,800. It varies, okay? So, calorie deficit is when you eat less than your requirement, you will lose weight. There's no doubt about it. There's two ways of achieving calorie deficit. The one way is eating less, but that's risky, it's not safe. The better way of achieving calorie deficit is by increasing your expenditure. So you exercise, you burn off more calories. So because you exercise and burn off more calories, you will need more calories to survive. But you don't eat more, you actually eat the same amount, but you're burning more. That is a safer way of achieving calorie deficit. In Ramadan, automatically we'll be in calorie deficit because we are fasting for longer. So it is a good way of losing weight, okay, but we shouldn't use a fast to lose weight, because if you stop eating or eat less or eat the wrong foods and you fast, there's a risk of your sugar levels dropping. Yeah. Yeah. Right, no, that's wrong. That plate, can we go to that plate again? Yeah, yeah, no, yeah, yeah, yeah. So the thing is, the body's main source of energy is not protein, okay? You have to define the two aspects, okay? The protein is needed for your muscles and for our strength and the function. The main source of energy is only carbohydrates. Carbohydrates is our fuel of the body, okay? If we don't eat carbohydrates, the body won't be able to function that much. Okay? Some people come to me and they say, oh, doctor, I have diabetes. I have diabetes. Why? Because I feel very dizzy. I feel very tired. But as soon as I had a carbohydrate or sugar eating, I actually feel good again. But that's not a sign of diabetes. You know how we mentioned smoking? Body can also become used to and addicted to sugar and carbohydrates also. Okay? So sometimes your body craves a carbohydrate. But to answer your question, I think the safer aspect is that you need more carbohydrates in the diet, especially in the month of Ramadan, because that is the main source of fuel. Protein is not a source of fuel. Protein is important, but the carbohydrate is the main source of fuel. Yeah, so we need to have a lot of carbohydrate. And even carbohydrate, we need to eat the complex carbohydrates. The type of carbohydrate that the body, it lasts longer in our body, so it supplies fuel for longer as well. Yes. Yes. Yeah, so complex carbohydrates are wholemeal bread. I think we mentioned brown rice, brown atta, um, lentils, sorry, yeah, so this, so rice, porridge, these are complex carbohydrates. High fiber, whole meal. So, and the refined carbohydrates are things that are processed. They're also carbohydrates, but they're processed. Like, for example, a bag of crisps. It made a potato, but it is processed. So that is non-complex. So that is a refined carbohydrate.
Just on that as well, I think when I was doing some reading yesterday, something I learned which I didn't know, that pasta, obviously everybody knows, is a good source of carbohydrates, but in Ramadan it's actually is classed as a very fast burning type of carbohydrate. So as the doctors who were saying, so eating pasta, for example, at Sehri time, thinking, oh, this is going to give me long-lasting energy, it won't, is less likely than some of the other options that we've mentioned. So it's more likely to burn over a shorter period. So something like, the main thing that they mention is oatmeals in Sehri is one of the best things that you can eat, because it's shown to release energy over a longer period of time. I think just the other thing is, going back to what Dr. Dasu mentioned right at the beginning, on one of the first few slides, is that there was a hadith that was mentioned, I think, in the notes section, that the Nabi Sallallahu Alaihi Wasallam said, to the nearest effect, that Allah subhanahu wa ta'ala likes that his servant acts upon his commandments. So like we do the faraid and the wajibat, and we act upon these, he also likes that we take advantage, or we make use of the leeway and the rukhsat that he's allowed us. So in these, in certain medical conditions, as we've touched upon, that it's not just to look at it that, or it's up to me if I want to act like a martyr, or if I want to, people think, oh, I'm going to really be a mujahid, I'm going to struggle, I'm going to do the fast, and I've got 1 hour left, I'm not going to break it no matter what. And they put it, this is contrary to the principles of the Sharia, because Allah subhanahu wa ta'ala has given you that rukhsat, that leeway, and you've already fasted, which was one thing, but then to then not break it when your blood sugars have gone to such a level is also contrary to the principles of Sharia. So you need to be very careful of this, that by trying to be a mujahid and trying to struggle through to the last step, it's very risky boundaries as to what's jaiz and what's not jaiz, because you're putting your body at risk. And it's not just for that immediate stage. As I said, you could fall over and become unconscious, but the long-term damage that you could do, for example, especially with hyperglycemia, the damage that's done to the eyes and the kidneys and the feet, etc., is long-term damage, which is hard to then recover. And then the doctors and the GPs and the NHS has to bear the burden of that over a long period of time, because people have not looked after their bodies correctly. I think there was a question from the women's, and there's a few other common medication routes which Mosa will just quickly, I think, touch on.
There's a question regarding using inhalers whilst you're fasting. So regarding using inhalers, because you're having something which is going down yourself, and the ruling regarding, there's different of opinion amongst ulama, but the most precautious and the generally accepted opinion is that using an inhaler whilst you're fasting will nullify your fast. Are there any other questions regarding the fiqhi aspects of fasting? Regarding eye drops, I think Dr. Saab mentioned as well, the eye drops does not break one's fast according to the ulama. There's no way the drops generally reaches the stomach, etc. So eye drops does not break your fast. If you inhale something through the nose, then that will break the fast. If something goes through the nose. In what? You can taste it. You can taste it, but it doesn't actually break the fast. If it's eardrops, there's two things, but the most preferred opinion through new research is that you have a barrier in your ear. If that is ruptured, and then you happen to put eardrops in, then that will nullify the fast. And if that barrier is not ruptured in your ears, and you happen to use eardrops, then that will if it is intact and you use eardrops, then that won't nullify the fast.
About the eye drops, on one of the slides it mentioned that what the glaucoma team advise is something called punctal occlusion. So everybody knows that they have a tear duct at the corner of their eye. So one way of preventing anything going through there, if you've put excessive eye drops inside, is to pinch that area, and if you keep hold of it, it will prevent anything from going down that thing. But Multab's obviously already touched on that.
Mouthwash is something which should be avoided. If something doesn't go down your throat, it won't break your fast. But because you put in some taste within your mouth anyway, so for this reason, it's something which should be avoided, and it will definitely make your fasting makruh. If it goes down, then obviously because you're going to go, if you start gargling or if you start swishing the fluid around in your mouth, then there's a high possibility of it going down. So obviously that will nullify your fast. But if you're very, very particular and you don't, then the least that will happen is definitely will become makruh. Toothpaste as well. That toothpaste will not break your fast, but it will definitely make you makruh. If you go to the dentist and if it's just generally just a checkup or something like that, then there's absolutely no problem in that. If you're even extracting a tooth or something, then it won't break your fast as such, but there's always a high possibility of something going down the throat, because obviously if you're going to extract the tooth, then blood, etc. may come out and that may go down the throat. So if you're going to undergo some major dental treatment, then it's recommended that you postpone it till after Ramadan. That's the best option. Is that everything? Inshallah.
That's it. So yeah, just to wrap up, Jazakallah to everyone, and especially to our volunteers, Dr. Dasu, Dr. Ibrahim, and Brother Ilyas, and also from the sisters' side in the morning. Obviously this event couldn't have taken place without their help. So just when everybody leaves from here, the van is still obviously outside, so you can access the services there, and you can, I think they're doing some blood pressure checks and stuff, huh? Yeah, so they've got a blood pressure check on board, and they've also got carbon monoxide monitoring on board as well, and some other services and literature that they can provide. So yeah, that's it. Jazakallah for everyone for attending. Assalamu alaikum.